Thomas Baldrick here at ASH 2014 with Dr. Guillermo Garcia-Manero from the MD Anderson Cancer Center in Houston, Texas. All right, sir, let's talk about this this phase 2 study you have with MDS and CMML at the heart of it.
So basically here we're studying a drug called SGI-110. This is a really interesting compound, and I think one of the most exciting drugs that we have. That is a second generation hypomethylating agent. So for quite a bit of time, we have had two drugs, the cytarabine and 5-azacitidine, that are basically the standard of care for myelodysplastic syndrome. And they're actually commonly used also in acute myelogenous leukemia. Actually, the cytarabine is approved also for AML in the United States, and the azacitidine is going through a similar process. But now we, for 6-7 years, people have been trying to develop a second generation compound, and this is the natural life cycle of this drug. So, and it has been difficult. And for the first time now, we have this compound that is a very smart way to deliver kind of like the same process that azacitidine and decitabine did, that is induced DNA hypomethylation. So what investigators that sponsor the study did was to develop basically a dinucleotide form of the decitabine. And what this does, it makes a more stable compound and potentially a much more powerful inducer of DNA hypomethylation than either decitabine or azacitidine. So when I started using this drug in the clinical trial, before I went in, I thought, well, maybe this will be more powerful, but maybe also more toxic, because I had seen this before in some of the studies that we did with some of the very powerful histone deacetylase inhibitors, drugs that I've worked for a number of years, that yes, we had these more powerful drugs in vitro, they look wonderful in the test tube, but then when we when we use them in the clinical trials, the toxicity was significant. So you have to walk through a balance. And then what I think was very surprising from this study was that, first of all, this compound actually doesn't seem to be much more toxic than regular azacitidine or decitabine. So in vitro, the drug actually strongly suggests that it is more powerful, yet in the clinic, this is a very well-tolerated compound. So now the next question is it possible that this SGI-110 drug could be actually a drug that will replace the first-line hypomethylating agents? And of course, for instance, in CML, we've seen that, right? Now we have second, third-generation TKIs in CML. I think we're looking at some similar phenomenon here. So I'm presenting data on behalf of a big group of investigators where we perform studies in MDS, CMML, AML, of this particular hypomethylating agent. And I think the data that I'm going to present on the oral presentation is very encouraging. I think that we're seeing response rates that are very acceptable, superior to what you will expect with hypomethylating agent, and a toxicity profile that is quite acceptable. Actually, probably even as good or even better than with your regular hypomethylating agent. So another question that you could ask me is what is next, because these are, of course, kind of like...
I was going to ask that.
exploratory phase 2 trials. I think you're going to see, hopefully, two major studies looking at frontline acute myelogenous leukemia with SGI-110. This will be a big international study. And at MD Anderson, we're going to, for now, pilot and enlarge our experience in myelodysplastic syndrome and CMML. So hopefully, in the next few months, we will be in a situation actually to design a powerful trial that could become the next standard of care for patients with hypomethylating agents with this new compound.
So promising future, perhaps.
Absolutely.
Very good. Thank you, sir. Always a pleasure.
Thank you so much. All right.